Welcome to Dateline Health. This is Fred Lippman coming to you from Southeastern University. We're right here in the Alan B. Levan Innovation Center, which is a combined effort between NSU and Broward County. And we're very pleased that you have shown up and are listening to us. You know, I always say the questions come from our viewers. Now, we're in our, I guess, almost the 25th year, and we're at well over 600 episodes, but they all come with reason and question from you, the viewers. We've had a lot of calls and writings and communications relative to AI. I just thought it would be good to bring in Elizabeth Swann, who's Dr. Elizabeth Swann, and she has a couple of other acronyms afterwards, which she's going to tell us what it's all about. And we're going to be asking, we're questioning her for you, how AI is being utilized in healthcare and education. Welcome, Elizabeth.
Well, thank you so much, Dr. Lippman. I do have a lot of letters behind my name. The one I'm most proud of is recently I was named a fellow for the National Academies of Practice. This is a national group, very prestigious, and we look at different topics, including artificial intelligence that we're going to talk about today, and how we can advocate for the future. How do we look at integrating some of this new technology into healthcare education? I'm also the executive director for the Center of Interprofessional Education and Practice. That means I connect to all 23 healthcare professions at NSU and all 9 of our campuses to bring students to that team science or team readiness as they go out to practice.
Well, that's a, shall I say, a mighty task. Now with AI adding on to the multiple ways of finding out how to care for you and what is inappropriate in our body, it is absolutely an imperative for us to focus on what you are just talking about. So give us a little more in-depth relationship to what the Center Interprofessional Education and Practice and how AI is utilized specifically.
Well, thank you again, Dr. Lippman, for this opportunity. I did bring along another expert in the field, Mr. Erik Boone from the Southeastern University Allopathic Medical School, as he is also engaged in some of our interprofessional simulations. So before I ask him to comment, I do want to respond to your question, Dr. Lippman. As we engage our students, we are looking at artificial intelligence to use in a simulation. Because what we know is artificial intelligence is a complex machine learning system, and it is trained on vast quantities of data on a massive scale. This allows us to use AI with our students. So in a virtual reality simulation, they have the opportunity of practicing a skill in a VR, virtual reality, maybe 10 times, 20 times, 100 times, anywhere in the world. They can go into the simulation and practice their skills and get comfortable and make mistakes and learn. The AI really personalizes some of that education and that clinical practice before they come back to the campus and look at some testing or assessment models to prepare them. Again, Mr. Boone, I'd like you to also to add comments to how we're using AI at NSU.
Well, thank you, Dr. Swann. So let me just introduce myself again. Like Dr. Swann said, my name is Erik Boone. I work for the College of Allopathic Medicine. I am the educational technologist, and my goal is to bridge the gap between traditional curriculum and cutting-edge technology. So as Dr. Swann said, I concur completely that AI provides a gap for students to tailor their learning. They are able to do simulation uh, for a clinical skills assessment prior to and really hone their skills. AI gives them feedback on where they can improve their uh, inquiries and techniques, and make sure that our students are, up to par, actually better than up to par, to be the best in the nation.
We've been using AI ever since we opened up our Clearwater campus, which houses many of our health professions units, including the College of Osteopathic Medicine and many others, nursing, things of that nature. But it is almost an imperative for the student who is about to become a healthcare certified professional to understand the nature of the anatomy, as well as what happens, what occurs with disease or shall I say malfunctioning. So I would assume that that's what you're presenting to your wonderful students in the College of Allopathic Medicine.
Oh, absolutely, absolutely. Um, I- so in my vision for the long-term goal is for them to use Gen AI as a tool, as a sort of collaborator. The power of it is that a student can go with a query about, so let's say, metabolism, and 2 days from now, he can have an epiphany or have a different way that he wants to ask this question. Gen AI will remember this was the question that was asked, and it will elaborate from there. The student will pose a new question. The Gen AI will go through its vast resources and attempt to give him more information on whatever it is. That that helps the student to grow, and again, it personalizes learning, and yeah, I guess simply that just helps our students to grow and become better physicians.
Well, I know because in my previous position as Chancellor of the Health Professions Division, now I'm Chancellor Emeritus, that there was a tremendous, shall I say, willingness and support by Dr. Hanbury to support AI in healthcare education, which is an imperative. There are not too many places, well, I shouldn't say too many, I don't want to denigrate anyone's presentation of how they present healthcare education, but to have that type of support is rather unique in today's world. And also, I believe that the future of healthcare is going to be, shall I say, molded and used in presenting the AI opportunities and the utilization of AI to make healthcare a much more, shall I say, overly successful. And I just believe that's where we're headed. Do you agree?
I do
Yes,
agree.
I do. And I want to give you an example, a PSA, public service announcement. We are talking in the month of October, and this is Breast Cancer Awareness Month. So get those mammograms, get that screening. A good colleague of mine just had her mammogram done. And when she got the readout, thank goodness, negative results, at the bottom of it, it said read by AI. And if you think about that concept, a physician may see 1,000 mammograms, but the AI has seen hundreds of thousands of mammograms and can be more detailed with this vast amount of data to look at a lower level of any type of pathology. So the AI is really supporting physicians and diagnoses, where it's looking at, again, the vast amount of information specific down to a personalized patient, and making sure that the physician can complement what the AI is doing. So that's an example, Dr. Lippman, of how we're looking at AI in healthcare.
I read a lot of the Mayo Clinic weekly commentaries, and they were talking about how AI is being so effective in what they call high density breast tissue. And that came up at this particular conference. And I'm just wondering whether you can relate to that type of response.
Yes, that's correct. And again, that technology advances so quickly. Day by day, week by week, there are advancements. And those of us active both in healthcare education and those healthcare providers that are active need to stay current. They need to stay up to date on what is changing and how can AI support and endorse some of that continuing education or professional development that all of us need to stay up with this technology.
Erik, you working as an educational technologist, and you come in contact, I would assume, very often with student messages, or sometimes it's more than just a message. Sometimes it's a shout, or sometimes it's a willingness to want to help me understand. So when you are handling this student population that you deal with, is there that question and answer opportunity for them to understand what is being presented to them through AI rather than through an anatomical lab?
So our students are encouraged to do research. You know, we don't just want to put out an excellent physician, we want to put out an excellent researcher. So they are always encouraged to investigate and bring back and to have questions for our faculty. You know, we have very knowledgeable faculty who can help them navigate this. So I want to throw out there that AI will never replace a physician. It is a tool. It is something for us to push the needle forward. It will play a much bigger role than it's already playing, but it will never replace a physician. So we want our students to be well equipped for the future, navigating AI, doing research, coming back, having discussions. Our dean of research is always willing and open to help students go forward and again become better at navigating this new technology and being the best thing that Nova Southeastern could possibly put out.
You know, with reference to what you just said, our audience, I can just hear it now, and I know that we'll get some comments from them. They don't necessarily see the nexus between research and education, because research, to a lot of people who are there, John Q. Citizen and Mrs. John Q. Citizen, or who are out there, they don't want to be examples of a research candidate. I understand the issue of research, and I certainly admire what we always do, but I want to be very careful to let people out there know that we're not talking about using you as research individuals. This is research relative to researching for knowledge, correct?
Correct. Absolutely. Thank you for clarifying that. Right. We do not want our patients to feel like they are guinea pigs. That is not the goal, but we want our physicians to be educated, to truly understand the pathology of a certain disease, whatever ailment that they have, so they can provide the best care possible.
If I can offer another example, I also work with the Clearwater Tampa Bay campus, Dr. Littman, and this summer I had occupational therapy and physical therapy in an interprofessional simulation. And they had to do part of the assignment on their own knowledge, their own experience. The second part of their assignment was to go into a generative AI tool like a ChatGPT, type in their question, copy, literally word for word, cut and paste that answer into their paper. And then the third part of the assignment was to compare. What did they first respond? what did the AI provide? And then what was the difference? I had over 100 students in this simulation, and what we found in looking at the results is that the AI tool by itself was very cold. It was very textbook. It just had the definition. It didn't have any life experience. So it was really a blessing that the occupational therapy and the physical therapy students got to see how they can use their own experience along with the AI information to provide the best care to their clinician and their patient and their client.
Dr. Swann, you hit on a very important thing in giving us that previous few minutes of commentary. We've had a number of people that are saying to us, hey, I don't want some new electronic technologic unit called AI telling me how to take care of myself. I want a human being. Because again, I constantly bring it up, because I always, every time I think of it, I think of Dr. Elaine Wallace, who always talks about mind, body, and spirit. I mean, you have to be able to talk to the patient at the point of danger, at the point of problematic involvement, or just whether they're going for their annual checkup. They want to have the knowledge come out of that person who is sitting in front of them, because the perfect example, and you just, I hope the audience got it, and I'm sure they did, is that the students in Clearwater that you spoke about, they already wrote their answers down. Now it's comparing to what AI is providing for them, and to either infer to them that they were absolutely correct or partially correct, or what you have to do to be more correct, or that you're a failure. So it's not AI doing the teaching, it's the example of AI helping you understand what you know. Is that correct?
That is absolutely correct. And AI being a tool for their toolbox. How can they use this tool to help their patients and clients? You know, my background is in sports medicine, and working with our physical therapy department, they can put into the AI, write out a knee rehabilitation exercises. And the AI can generate 1,000 of them. But the physical therapist still has to work with the patient client one-on-one and understand what are their limitations, what are their strengths, and identify what is the best fit for that personalized healthcare.
Healthcare professional has to have, it's an oversimplistic term, hands-on work and knowledge. Hands-on work and knowledge. How's that, Eric? Is that pretty good? Am I a pretty good student?
You are a great student. You are an excellent student, actually. Listening to the conversation that Dr. Swann just had with you regarding this, I think about all the AI-driven robotics that are just tools in the hands of our future physicians, our current physicians. When we think about something like let's say prostate cancer, something dear to all men. By the age of like 100, most men, maybe 1%, will not have prostate cancer. It is what it is. But the tool, the gold standard for that surgery is robotics, is AI-driven robotics, so that the physician can be accurate, can make sure that he removes as many cells as he can without damaging nerve bundles. This is, Gen AI is part of our life, and I think overall it's going to make us better. The robotic cannot explain to the patient, this is what we're going to do, this is our goal.
Well, I'm sorry, Eric, you just hit on 100% the issue that these folks out here who are viewing us want to know, and that is they don't want some inanimate metal, concrete, whatever unit is doing whatever it's doing. They want your hands, the physician hands involved. And when I say hands, it may not be that particular hand. It may be some instruments, obviously, or some radiologic instruments or otherwise. But that's the real issue. That's what these folks are interested in. I think that AI and technology enables the human spirit to understand how to use that human spirit. What do you say?
Oh, I agree. I agree wholeheartedly. I think about the previous convers the ability to go back and revisit research that I did earlier and have AI remember this is where I left off at. I think that's really, really important because we have epiphanies about things that we're trying to learn about, that we're researching. And I think that's just critical versus going back to a book, and that book might be earmarked, but when I read it a second time, it might not strike me the same ways as the first time. And also to what you're saying about about AI, and I'm going to throw in there robotics. It is the physician who is doing the surgery, doing the procedure, and it's going to be that physician's experience and like mind, body, and spirit and intuition as he delves into that body part to look at it and maybe see something that looks a little uh, suspicious, for him to go a little further versus it being so straightforward. Does that make sense? I might see something else that AI can't see because it's just a tool. But my experience has said when I see this here, the outcome has been for the last 500 patients that I've seen that this is not good, and we should proceed to do a little bit more.
Elizabeth, I think I've said this to you personally, but AI and the new technologies that we have, just think of it as, you walk into a room and it's dark and there's no light at all. You take out of your pocket a flashlight, figure out where to go. To me, oversimplistically, that's what, and not to demean or denigrate any of the AI or any of the other features, but that's what it's all about. You have to put that flashlight, which now gives light in that room, the same value that technology would give to the human spirit and the human being to be able to take care of patients. Correct?
Yes, you're absolutely right. And we reinforce evidence-based practice. And so with that flashlight, and you're looking at that light in the room, the telemedicine, the algorithms that the artificial intelligence can do will pull out that light and encase the entire room for our future healthcare providers to be the best they can.
I want to thank both of you for your time, your effort, your spirit, your knowledge, because that's what you do. You're giving us knowledge through the healthcare professional who then present it back to us, and hopefully we live a more valid and safe life. How's that, Elizabeth? You taught me pretty well, right?
Yeah, well, I think I learned from you, the master, Dr. Lippman, but that's what makes Nova Southeastern University so special, is we are cutting edge. We are diving into AI and getting the resources, giving that to our students so they can be the best.
That's right. They can be the best. Well, Erik, go ahead.
No, I was agreeing. I concur with both of you. Dr. Swann said it wonderfully. We are striving to be the best. In no time, our 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 outcomes prove that the College of Allopathic Medicine is something to behold. Our students are doing very well. We're so proud at some of the placements that we've had. Yes, we want to put out the best doctors that this country is going to see.
Well, I can tell you again, like I said, I've been part of this combined operation for close to 40 years, and I'm so proud of what you both do and the students who are trained and educated by you. So thank you both very much for your efforts. As I say to these folks, again, I tell you, take good care of yourself. Remember, if you have any questions, you have any comments, there's an email and telephone number right here. And as I always say to you, I am Fred Lippman. I come to you from Nova Southeastern University. Until next time, see you.